USMLE Step 1 cases are so boring. I can't even remember how many times I slept while doing them. They're not engaging at all. And this is why in this channel, I'm trying to turn them into stories in order to make them more interesting and easier to follow. So here's a case of a 47-year-old overweight man who came to the clinic for a follow-up. Why? Because he has a history of hypertension that is supposed to be controlled by amlodipine. And so he came today to check if the amlodipine is working or not. And so when the doctor measured his blood pressure, as you see here, it turned out to be 145, meaning amlodipine is not enough to decrease the blood pressure to normal. In addition, this patient has hyperlipidemia. Of course, as you see here, he's an overweight. And so when a blood sample was taken to measure the LDL and triglyceride, the LDL turned out to be 160 and the triglyceride turned out to be 145, which is high. So here you have a patient with hypertension and hyperlipidemia, and the amlodipine is not working. So what are you going to do to decrease the blood pressure? Which drug should you add to amlodipine to control the blood pressure? And here are the answer choices. If you do not understand the physiology and pharmacology of blood pressure, please refer to the video above in order to, get a general idea before jumping into how to answer this question. In order to answer this question, we have to understand how physicians actually prescribe antihypertensive medications. Let's imagine that this is you, this physician right here. This is you, my friend. And you have a patient with 145 blood pressure. Of course, you give the diagnosis of hypertension, right? And then what are you going to do? Are you going to just leave it and say, okay, it's hypertension, go home? Of course not. You have to decrease the blood pressure to become normal. And so you start thinking about, all these pharmacology drugs, like which drug should you prescribe? Let me help you out a little bit. In order to decrease blood pressure, you have to give a first-line antihypertensive medication. This is the first step you should do in order to decrease blood pressure. You actually have three. The first is thiazides, calcium channel blockers, and ACE inhibitors. These are the three first-line drugs. So you have to choose one of them in order to treat the patient. Physicians normally prefer the calcium channel blocker as a first drug to give to a hypertensive patient. So they prescribe a calcium channel blocker, especially amlodipine. So you give the patient amlodipine and, the blood pressure shouldn't go down. The patient already is or already was on amlodipine, right? But it did not improve his blood pressure. So what is the second step? What should we do? The second step is to add another antihypertensive medication, one of the three we know, and the blood pressure shouldn't go down. How would you know which one to choose from? Let me give you a hint. Physicians choose between drugs based on individual patients, side effects, and drug effectiveness. So let's say you added another drug, let's say thiazide, and it did not work. What should you do? In this case, this is a resistant hypertension, and you should add one of the two of these drugs, beta blockers, or vasodilators, other vasodilators like hydralazine. So let's go back to our case here. Which one should we add to amlodipine in order to decrease the blood pressure of this patient? We should add another first line. So which of these are first line? The only two we have here of the first line medications is hydrochlorothiazide and lisinopril. So how do we choose between the two? And in this case, the patient has hyperlipidemia. And you should know, and it's a very high yield point, that hydrochlorothiazide can cause hyperlipidemia. In fact, there is a mnemonic that is well known about hydrochlorothiazide that causes a lot of hypers, like hyperlipidemia, hyperglycemia, and hyperuricemia. So this patient has hyperlipidemia, so you will not give hydrochlorothiazide. You will give another first line, which is lisinopril. And this is how you answer the question. Let's eliminate the other answer choices. Furosemide, it's not used at all in hypertension because it's a very powerful diuretic. It's most commonly used in ascites, which is, a lot of volume overload in the body. And of course, like we said, the patient has hyperlipidemia, so we cannot choose hydrochlorothiazide, even though it's a first-line medication. We cannot use spironolactone because it's a weak diuretic, and we usually preserve spironolactone to patients who have hypokalemia due to other drugs. And of course, metoprolol, it's a beta blocker. We don't use beta blockers as a first line at all. We use it mainly in patients with heart failure to decrease mortality. So that's it. Thanks for watching.